Julius Randle of the Knicks looks like he may have just suffered a shoulder dislocation against the Miami Heat. Julius was going up for a layup and took a hard hit and fell to the ground. He was immediately holding the right shoulder. And for shoulder dislocations, you have anterior or posterior. Anterior is much more common, especially in athletes. You'll see a posterior dislocation. The classic example you get in medical school is someone got struck by lightning and they had a posterior shoulder dislocation. Now, what this is essentially is the humerus, which is the arm bone. The head of it comes out of the socket, which is from the scapula. This is also, and this is called the glenoid. That's the part of the scapula. So this is known as the glenohumeral joint. And this joint is also stabilized by various muscles and ligaments. You have your rotator cuff there, which are known as the sits muscles, which stands for supraspinatus, infraspinatus, teres minor, and subscapularis. And hopefully there is no damage to any of the rotator cuff muscles. Most likely they are going to try and pop it back in the back room. It seems like the trainers were taking him back right away. They're going to what's called reduce the shoulder, and there's a couple different techniques to reduce the shoulder that we'll talk about in just a minute. I've actually had to do this while doing sideline coverage for a high school football team, so it's definitely something that does happen commonly. Sometimes it's not as severe of an injury as you might think. However, there are other possibilities of ligament damage, muscle damage. You could have also fractures with shoulder dislocations or other lesions. So for example, very common lesion that you might get is known as a Bankart lesion, as well as a Hill-Sachs lesion. Now this happens when the humerus gets dislocated anteriorly. The back of the humerus, so the posterior side, scrapes against the labrum, and that scraping can cause damage to the labrum, known as the Bankart lesion. It can also fracture the posterior side of the humeral head, known as a Hill-Sachs lesion. So what likely is going to happen now is first, they're going to try to reduce the shoulder. Sometimes it can be done with anesthesia. Sometimes you could be doing it on the field or in the back room. There's a couple different techniques like we mentioned. There is the Stimson technique where you're lying on a table with the arm down, hanging down, and you're just slowly applying gentle traction and letting gravity do the work. It's also very key to have the muscle relax as much as possible. There's techniques which incorporate using external rotation, so moving outward like this to get the shoulder back into place. There is the traction, counter traction method, sometimes using a sheet to give counter traction while you're pulling the arm in traction. And there's numerous other techniques that can be used. Most likely, Randall will, if it is a shoulder dislocation, which it seems to be, they'll reduce it. He'll get x-rays. Because he's a pro athlete, he may get an MRI right away, which is not always indicated. He'll definitely be recovering with physical therapy, and ideally or hopefully he doesn't need surgery, because that's definitely going to prolong how long he's out.
So in summary, if this was just a subluxation, meaning it didn't come completely out, it wasn't dislocated, this would be a couple weeks maybe that he would be out, potentially even shorter with some rehab. If it was a dislocation with no other damage and they were able to pop it back in, probably 4 to 6 weeks with rehab. And if there is a more severe injury, like any type of fracture, a Bankart lesion, that might need surgery, and that could be season ending. We're going to keep our fingers crossed that's not the case.
I'm a huge Knicks fan, so this was devastating to see, but I hope Julius is okay. Hopefully, maybe it's not a shoulder dislocation. I'm sure the news will be coming out soon, as this video is already out there. And
hope you enjoyed this video. If you are enjoying this type of sports medicine content, please like, subscribe. It really helps grow the channel, and I will see you in the next video.